ICD-10, keeping up with the times. Recent changes to ICD-10.
ICD-10 is a medical coding system used by healthcare providers to classify and diagnose diseases and other health conditions. In recent years, there have been several significant changes to ICD-10, which are important for medical professionals to be aware of. One of the major changes to ICD-10 is the introduction of new codes for emerging diseases and conditions. For example, the recent outbreak of the COVID-19 pandemic has led to the addition of several new codes related to this disease. This allows healthcare providers to more accurately document and track cases of COVID-19. Another change to ICD-10 is the regular update of codes and definitions to reflect advances in medical knowledge and treatment. For example, new codes are added and old codes are updated to reflect the latest research and best practices in the field. Finally, the implementation of ICD-10 has been expanded to include not just diagnosis codes, but also codes for procedures and treatments. This allows for more detailed and accurate documentation of a patient's medical history, which can improve the quality of care they receive. In conclusion, ICD-10 is a constantly evolving system that plays a crucial role in the world of healthcare. By staying up to date on the latest changes, medical professionals can ensure that they are using the most accurate and relevant codes for their patients. Please like and subscribe the channel.